Here at Hurley, we probably get anywhere from 10 to 15 a month, brand new cases. That doesn't include recurrences or, but that's roughly what we see as brand new patients, about 10 to 15. That's just here. Then you have to think about Genesis, McLaren, all the other resources. So in Flint, there is a significant number of patients with breast cancer. So, making sure that women look for their navigator wherever they're at to get the help that they need is super important. So we help women make decisions, what kind of treatments they're having, help them understand how to manage side effects. So certainly tapping into our support groups. We have quality of life programs if they're feeling really stressed, whether it's education, just a big hug, so that they're not so afraid, but to let them know that there's lots of support on this journey. Also do some fundraising, which helps make us have a resource available to help women if they're in the midst of treatment and really starting to struggle financially. Well, you know what, if they're coming through the Hurley Health System, the physicians try to get their paperwork to me immediately so that I can initiate phone calls to start giving information and support, answering questions. But a great website women can go to is breast360.org. It's a trustworthy website where they can go and start learning about what their diagnosis means. I think going to appointments with their loved ones so they can be a second pair of ears. I think when people hear, I know women, when they hear, or men that get diagnosed with breast cancer, you hear the word cancer, a veil drops, and sometimes that's all you hear. So then your next point of reference is whoever you've experienced it with. If you have a loved one who's gone through breast cancer, you immediately step in their shoes and their story. So that starts to become what you think is going to happen to you, and every situation is completely different. If it's someone who was diagnosed years ago, we have new treatments, we have all different types of resources that maybe someone didn't have access to. So I think the important thing to remember is that your story is your story, and we have to take it one step at a time and help make sure that you understand what type of cancer you have, what types of treatments are available, and then help walk you along that. So a loved one can come along and help be an extra pair of ears, help explain and reiterate what they heard so that they can help bring the stress level down. I think that's really helpful. So, we see breast cancer in an aging population, but we're also seeing it in younger and younger women. Maybe the woman is a single mom, maybe she's a working woman that helps support her family along with her husband, and the patient might be out of work for a period of time because they're in very aggressive treatment. That can cause tremendous financial hardship, or a fixed income for someone who may be older. So what we do is, if they're struggling financially, they can fill out a qualifying form, and we can help pay for water bills, utility bills, co-pays, whatever it is that is creating a situation where they may not be able to continue their treatment or complete it, or just to help assist them so that they're not financially in trouble. One of our nurses on 9 East had mentioned that her 5-year-old daughter wanted to make a difference in someone's life, and she had grown her hair and it was 11.5 inches long, and so she decided that she would have it cut and wanted to donate it to Wigs for Kids or Pantene Hair to help someone else. So really, sometimes we think, well, what can I possibly do? If you knit, you can make knitted knockers. If you have long hair, you can donate hair. If you have lots of different skills, we have volunteers that do a ton of things to help this program. We have women who sew, who knit. All you have to do is call me, and I can give you patterns for lots of different things you can make to help our patient.